Okay, good afternoon. Thank you very much, everybody, for coming to Parliament Hall this afternoon. We have a fantastic lineup of international speakers, and it gives me very great pleasure to introduce our chair for this afternoon, who is Dr. Richard Smith, who's the former editor of the British Medical Journal, who's agreed to chair the symposium. That's great. Thank you.
Right, well, good afternoon, everybody. Are you feeling lively and wide awake? So I used to be an editor for many years, and I have a sort of standard way of introducing the way the world thinks about editors. Adlai Stevenson said an editor is someone who sorts the wheat from the chaff and then publishes the chaff. And we had a very celebrated example of an editor of the Journal of the American Medical Association who came very unstuck in all sorts of unseemly ways and had to be fired. But he used to say every editor should have a pimp as an older brother in order to have somebody to look up to. What I do these days is, because I've left the BMJ, is I run a program whereby we have 11 centres in low and middle income countries working on NCDs, non-communicable disease, by which we mean cardiovascular disease, diabetes, chronic obstructive pulmonary disease and cancers, because these things are largely caused by tobacco use, poor diet, physical inactivity and the harmful use of alcohol. And last September there was a United Nations meeting on these NCDs in New York. This was only the second time that there had ever been such a high-level meeting on health. The previous one was about AIDS in 2001 and led to the Global Fund for AIDS, TB and malaria. But why this is relevant is that there was a huge debate about whether mental health should be included. And in the end it wasn't. But I think there was quite a lot of resentment about that, because not only because I'm going to give you a few figures in a moment. I mean, mental health is, if you view things globally, neuropsychiatric conditions account for a huge burden of disease, and that burden is going to get bigger and bigger. But also, if you are thinking about NCDs themselves, if you want to do something about people with chronic obstructive pulmonary disease or whatever, then thinking of the mental health angle is enormously important. So there was a sense that actually this was a little bit unfortunate. And now there is a big drive to hold a similar meeting around mental health. Probably many of you are aware of the burden of mental health problems, but there's something called the global burden of disease, whereby conditions are ranked by DALY, disability life year, which is a mixture of both mortality, people who are dying, and also people who are affected, so mortality and morbidity. And depression is number one in all of that, and dementia is extremely important and rising. Schizophrenia is a global problem. And 22% of DALYs in women aged 15 to 59 are down to mental health problems. There are 1 million suicides a year in the world. There are 25 million people with dementia, and by 2040 that's going to rise to 80 million. And yet, in much of the world, a lot of treatment is just not available. I was a student in Edinburgh. I was in Edinburgh recently where there was a meeting on mental health, and somebody put up a slide of a doctor in Malawi, and they said, this man is the mental health service for Malawi. There is nobody else. There is one psychiatrist for the whole of Malawi. So in much of the world, there are very few services available. And then you have the problem with mental health problems, which we don't have in the same way with NCDs, of stigma. And often the stigma attached to mental health problems is a huge problem in itself. So like I say, there is a drive to have this United Nations meeting on mental health issues, and I think it may well happen because lots of countries are very concerned about it. And I would recommend to you an article in PLOS Medicine, Public Library of Science Medicine, published in January, which makes the case for having such a high-level meeting. And the three things that the authors of the article asked for when the meeting happens is, one, that there should be wide availability of an evidence-based package of both preventing mental health problems and treatment, that people with mental health difficulties should be empowered, and that there should be much more research. So, things are sort of looking positive, but I thought I would just end my introductory remarks, I went to a pretty interesting meeting in Heidelberg, the European Molecular Biology building last year, where there was a whole session on mental health and the treatment of mental health issues, rather like today in a way. And there were quite a lot of sad things there. I mean, one is that many drug companies actually have pulled out of mental health issues because they're finding they're just not able to produce the drugs. We're going to hear more about from the pharmaceutical industry later, but quite a lot of companies have said this is just too hard, that brain science isn't sufficiently advanced for us to be confident of producing useful drugs. The drugs for schizophrenia, although they are available and have been available for quite a long time, are often not very effective. Probably only something like 10% of patients with schizophrenia reach a stage where they're as good as they could be. Lots of people, their treatment is not adequate. We don't really have any kind of effective treatment for Alzheimer's. And then depression, the number one problem, which we're going to hear much more about this afternoon. So something I've been very interested in is the whole issue of publication ethics, and there is a great anxiety that much of the research that is funded on antidepressants and do they work or not, almost all of that research is funded by industry, which is true of all drugs. And when you look, there's a sense that a lot of positive studies are published and negative studies are not published, and that we may have been deceived into thinking that antidepressants are effective when actually they're not very effective, because there is an enormous placebo effect. And this has given rise to a lot of anxiety about the relationship between the pharmaceutical industry and particularly psychiatry. We may hear more about that as the afternoon goes on. We were having a discussion over lunch. There are quite a few prominent professors of psychiatry in the US who've had to step down from their positions because of their over-close association with industry. And there's a very big debate going on at the moment around the classification of psychiatric disorders. At the moment we have DSM-4, DSM-5 is underway, hundreds of different conditions, and there's a lot of anxiety that that is over-influenced by the pharmaceutical industry. Also at this meeting in Heidelberg, and we're going to hear again from Germany this afternoon, there was a lot of talk about psychoanalysis and psychotherapy, and someone had gone to the trouble of working out how many schools of psychotherapy there are, and he totted up 350 different schools of psychotherapy. And in Germany, there's an expenditure of 750 million euros a year on psychoanalysis, and yet most people, ordinary doctors like me, think that psychoanalysis doesn't really work at all. We've got no evidence from randomised trials. Also at this meeting, because we're sort of a little bit desperate in how to treat depression, which I think in some ways, almost by definition, is the world's worst problem, because it's part of the disease that you can't really ever imagine being better. But we've begun to resort to deep brain stimulation, where you put an electrode into somebody's brain and stimulate it. And they've done trials on this, but it's somehow you think, can this really be the best way to treat depression? Are there not much more effective ways? So I think there's a lot of things that we're going to be able to get through this afternoon. So the way it's going to work, we've got 4 speakers. They've each been allocated half an hour. Talking to them, I think most of them are going to use their half hour. I'm not going to let them go beyond that, because I think we want to keep the momentum of the meeting going. And they will score a brownie point if they manage to finish a little bit early, so we can have some questions immediately after the lecture. But we then have 40 minutes at the end of the afternoon for raising all the issues. So I would urge you to write down a question that might occur to you. So if you don't have a chance to answer it immediately after the speaker, then you can ask it later.